Hi guys, I'm Adrian, the nurse injector here at our Frisco location at NTPS.
Hi, my name is Tammy. I'm the esthetician here at the Frisco Lake location.
We want to talk to you guys today about the importance of working with your aesthetic nurse injector as well as an esthetician. So the aging process, as we know, is multifaceted. So we have many different changes. We have volume loss to the skin.
Plus we have photo damage that causes discoloration and fine lines and wrinkles.
So if you think about it physiologically, we've been using our muscles since we were infants. So we don't notice that many changes when we're in our 20s. But after 30, we stop producing collagen.
So after 30, our collagen starts to degrade and we lose it. So over the years, you lose more and more collagen and elastin. That means that your facial structure is going to start to sag and more discoloration is going to come up from past photo damage. So if you think about it, our elastin is our spring in our mattress. The collagen is actually the mattress part. So when we're degrading that collagen and elastin, the mattress starts to get thinner and thinner, and that means more lines and wrinkles will come up.
So with Botox, when we do that, it's relaxing that muscle. So when it relaxes the muscle, the skin gets a break and it relaxes because it's been under constant tension and it's kind of been scrunching the skin the whole time, contributing to, as Tammy was saying, with the fine lines and wrinkles, not only from the constant movement of the muscle, but also with your collagen and elastin loss. So as we age, when we have those changes and volume loss, I can restore that with fillers like derma fillers, injections, as well as biostimulators. And then Tammy can take care of the texture.
With texture, there's several treatments we can do. First, I want to get the skin back in good health. So I usually start with skincare, really good medical grade skincare. And then after a few weeks of being on that, then that's when we start the treatments. We can do lasers such as the Cyton broadband light that helps address the discoloration in the skin. We can also do the halo, which is going to be a resurfacing treatment that's really going to help the texture of the skin. So those are two things that we can do. And then I think it's important to address the with one comes the other. And so Adrian will address more of the deeper lines and the expression lines and the volume loss through her treatments.
100%.
And then I address more of the textural issues and getting the skin back in good health. After we do our treatments, it's important to keep and maintain the progress and the health of the skin that we have done. So let's say doing quarterly treatments with me, also keeping on the medical grade skincare is real important. And with Adrian, you're going to come in quarterly or every 3 months.
So when a patient comes in and we talk about the aging process and we've gone over, different things that they want to address, we go over those goals. And depending on what that is, I'll oftentimes bring Tammy in, especially if it's texture things. I can take care of some deeper lines, but if it's more fine lines, then just some fine tuning, some texture, tone, pigment changes, I'll often bring Tammy in, and then Tammy will take over and do a skincare analysis on that patient.
So with the skincare analysis, I usually bring the patient back. We do the Blvd analysis. That is such a great, thorough analysis of the skin. I can actually see where the sun damage is. I can see where the veins, the broken capillaries are. We can design a treatment plan based on the results of the Blvd analysis.
For long-term maintenance, we typically do Botox every 3 or 4 months, and then we do fillers or biostimulators usually once a year.
And for me, we are going to do we're just going to continue doing treatments quarterly, but also maintaining the skin with good medical grade skincare. And those two together are such a great way to maintain healthy, luxurious.
I love that word, luxurious skin.
I will say skin treatments and medical grade skincare is the two elements you need long term to create a healthy, rejuvenated skin. After we've done several treatments, we can actually do more pictures on the Blvd analysis to actually see the long-term results that we've made.
So oftentimes when patients come in for fine lines and wrinkles, just for the textural changes also, when we do Botox, it's gonna relax the muscle. When you relax the muscle, the skin gets a break and it also relaxes. Most common areas we do it are here in the center, the forehead, the crow's feet for these pesky little lines when we smile, and then also around the lip. You can do different things with Botox. You can do a lip flip, and you can also just soften these little lines here. But also sometimes in combination, we will need to do some textural changes with Tammy for those pesky little lines around the mouth area.
And for those lines, I usually will do like the CO2 laser, which really is great for softening those lines around the lip area.
So for Botox, there's really minimal downtime. You usually just have the injections. You might look like you have little bee stings, and then those resolve in about 30 minutes. Also, when you're doing filler, you might want to plan for a little more downtime, meaning in case you have bruising. So I always tell patients you might have bruising, just plan on it 50% of the time. So if you have a wedding to go to or a special event, you want to give yourself a good 10 to 14 days for downtime, so in case you do have any of that bruising.
With the CO2 or the halo laser, you're going to have about 5 to 10 days of downtime with it. So it's real important to schedule accordingly for your work or for your personal life in order to get the treatments done. So I've been in the aesthetic business for over 20 years. And Adrian, how long have you been?
It's been 22. So combined, you can see how young we are.
I think our favorite part of the job is really creating a treatment plan for the patient together.
100%.
Because we get the best results that way. And so...
And since the aging process is multifaceted, there is no one treatment that fits all. I think that's so important. I get a lot of questions about that because Botox only does certain things. It's only going to relax the muscle. Fillers are only going to create volume, and aesthetic treatments are going to target that skin and that skin health, and that's so important. Whereas somebody coming in, they might talk about some loss of volume, but overall their goal at that time might be skin changes, textural changes, fine lines and wrinkles. And I think skin health is so important. So that's an everyday thing because unfortunately we're aging every single day and we wear our skin every single day. So you want to take care of it.
Yes, I agree.
If you'd like to schedule a duo consult with Tammy and I, the website's listed below.
And if you have any questions or comments, leave them down below. Also, like and subscribe.